Lancashire Teaching Hospitals provides a regional service for all dialysis patients. We cover the whole of Lancashire and South Cumbria, and we go all the way up to Barry-in-Furness, which is about 100 miles from here. Having the facility to put the Polycom equipment in a patient's home in a lot of these rural locations, it allows a patient to stay where they are. It enables them a lot more control over their dialysis and the times that they use the system, whilst also having the ability to speak to a nurse or another healthcare professional at the end of the video screen.
Normally patients who dialyse in the hospital will come into the hospital 3 times a week, and the treatment usually lasts about 4 hours, and with that you've got to put onto the factor of journey time into the hospital.
Instead of the patient spending a lot more time in the hospital setting, they can go home earlier with the ability for the nurse to see the patient in the home setting and advise them. The nurse can zoom in out of the room and to the parameters on the machine or to the patient's arm, whilst listening to what the patient's got to say.
The first 3 months is probably the most likely time that the patients would have difficulties. With a video call we can resolve the problem and avoid patient admissions back into the training unit. So it's very high definition, so we can actually see every aspect of the dialysis treatment as if you were in the room with them.
It's empowered patients, it's allowed them the freedom to sort of stay at home and dialyse at home. John Slater is about 40 miles away from Preston, and he's been able to go home earlier with dialysis.
Dialysis patients, their memory isn't very good, and obviously getting on dialysis machines, there's a lot to remember. So if he needs anybody, he's got somebody there within a second who can just click the button and he's straight through to a nurse who can coach him through any issue. The benefits for us are that he's home all the time, so that means he's much calmer.
And I like to be independent, and this gives me the independence that I like. I'm not stuck to 9 till 5, I can do it in the evening, or I can do it in the morning, do it at the weekends. It gives you the freedom, but it is better for me to have the home care here. It's like being in the room with them.